We have 7 quantitative measures to which we applied this framework. The first of these here is readmission to the hospital within 30 days of discharge. And this is a measure where we'd like the rate to be as low as possible. If a hospital completely manages the patient's illness during the initial admission, then the patient should not need to come back to the hospital within 30 days. And to the extent that the patient comes back, it's an indication that perhaps the problems were not completely addressed in the initial admission. In a similar way, the next measure is return to intensive care unit within 24 hours of discharge from the intensive care unit. And the logic is similar, that if the initial stay in the intensive care unit completely resolved the patient's problems, they shouldn't need to come back. And to the extent that they did, it's an indication that perhaps the initial intensive care unit stay had not completely resolved the problems. The third measure is return to surgery within 24 hours. In a similar way, if the initial surgical procedure completely resolved the patient's problems, they would not need to come back. But if they do, it's an indication that perhaps the problem was not fully addressed or there was some complication of the surgical procedure. The fourth measure is the turnover of hospital staff. The specific measure is the percentage of staff who voluntarily or involuntarily left the hospital within a 1-year period. And the logic here is that when a staff member leaves, the hospital needs to try to recruit a new person to do that person's job. It needs to train them, and it will likely have a period of reduced productivity while the new staff person learns the ropes of the job and learns to work with the other staff members in the hospital. And so in the case of all of these measures, the lower the measure, the better is the quality of care. The final group of measures are ones where higher values are better. So the first of these is the admission of international patients to the hospital, and that's quantified as the percentage of patients of any nationality other than Jordanian who come to the hospital for medical treatment within a 1-year period. And the logic here is that the higher the percentage of international patients, the higher is the quality of care and the reputation of the hospital. From patients who making a choice for themselves or their sponsors could send the patient anywhere in the world, and they voted with their feet in coming to this hospital in Jordan for medical care. The next item, 6, is the completeness of medical records. The JCI accreditation process has a series of 35 categories of information that should be documented in every patient's medical record. And by looking at a sample of records, we can identify the percentage of those patients which are percentage of those items which are documented, and thereby score the completeness of each sampled medical record. The last indicator is the financial solvency of the hospital, and that can be quantified as the extent to which the revenues of the hospital exceed the hospital's expenses for a particular fiscal year. And if they were just equal, the hospital would break even. If the revenues are higher, the hospital has exceeded a surplus in its operations in that year. And the more the surplus, the greater is the financial solvency of the hospital.